One of the non-surgical treatments for a cervical herniated disc is massage. I had a chance to speak with Andrea Wolkenberg, who is a medical massage therapist, and get her opinion on how massage can be used to treat the cervical herniated disc.
All of the modalities that we use in all of our treatment is geared towards increasing circulation.
Right.
So medical massage is one way of doing that,
Okay.
of manipulating the tissue and increasing the lymphatic flow in the area, bringing more blood to the area, taking waste products away.
Okay.
And so we do that manually. So we're just manipulating the tissue with our hands to do that. There are lots of ways of doing that. That's one way. It's a great way. I do think it's one of the best ways.
Are you treating the herniated disc, or are you just treating the
No.
symptoms of the disc?
You're treating both.
Okay.
You're treating the symptoms of the disc because
Right.
when you have pain, you go into spasm.
Right.
When you have spasm, you splint,
Right.
and that decreases circulation, which decreases oxygen, which decreases, which doesn't allow waste products to kind of get out of the area that
Right.
are created. So there's a chemical imbalance that occurs, and that gives you more spasm. So it's a cycle.
Right.
So
So
you
you're
have to
breaking
do
that.
something to break into that cycle.
So
Exactly.
they call it medical massage.
Yes.
Is that, can people go to a massage therapist down the street from them and do that, or should they do this from someone who's specifically called a medical massage therapist?
There are probably 20 different kinds of massage.
Okay.
And medical massage implies that the person who is performing that massage, is licensed, and one should always go to a licensed massage therapist.
Okay.
That's always a good idea because you know that they're credentialed. And someone who knows how to work with injured people.
Okay.
And sort of errs on the side of safety and knows what precautions to take. So
You need a licensed therapist.
You should have a licensed therapist.
So to see what a licensed physical therapist would do with medical massage, I visited with the therapist Hema Bellam Ramjan to get an idea of her approach to a patient with a cervical herniated disc.
So this patient has cervical fusion C6C7, and he has soft tissue tightness,
Okay.
all from suboccipital level and all towards his lower back. He has
Okay.
myofascial tightness, so what I'm doing is I'm doing some soft tissue release to decrease the tightness in his neck. So once we finish, he'll be able to do a little bit more range. He'll be able to turn a little bit more, so there's less restriction and also less pain when he does his normal, daily activities. So just trying to release this upper trapezius right in here. I'm going a little deeper. Where's the scalenes, and here's your suboccipitals. Releasing that. So very gentle, really not too deep. I'm not going towards all towards his joints. Then release all towards his back. He also has back pain, so I'm doing the combination of from his neck to his back.
Okay.
If he has trigger points, I would actually work on the trigger points. He has a few of them in his upper trapezius area. But since he is very sensitive, I'm not doing too deep of a release, so I'm going really gentle for him.
Okay.
It's more of myofascial release and soft tissue release combination than specific trigger point release for this particular patient. But if he does have some, then I do some release.
And for cervical herniated discs specifically, do you do this specific treatment, or are you doing other types of treatments?
I do a few other treatments. If he has a herniated disc, depending on where the disc is it a posterior herniation or a posterolateral herniation or an anterior herniation? Depending on that, I do specific intervertebral joint mobilization to reduce the disc if it is reducible. If it has a disc bulging or more so disc protrusion, then the mobilization really helps. But if it has gone to a point of disc extrusion, then the man will really doesn't do much. But because of the herniation or because of the bulge, if the soft tissues are tight, they on one side or both the sides, then the release really helps, and along with that, the intervertebral mobilization also does help. So, yeah.
Okay. So the bottom line on medical massage is I love massage, and the only thing better than massage therapy is free massage therapy. So try to get it covered within your physical therapy prescription and do it with the physical therapist as part of that program. If you like it and it's working out for you, then you can get more massage therapy on your own, as long as you look out for a certified medical massage therapist as the person to treat you. Remember though, this is treating the muscle spasm and neck pain. It's not treating the herniated disc itself. So if you're not getting better, you're going to have to move on to another therapy.